Hi everybody, my name is Alicia and this presentation is on a patient with CHF exacerbation. This patient is an 86-year-old male. He is married and lives with his wife in his daughter's home. His social support system includes his son, his daughter, and his son-in-law. His daughter is his primary caretaker as he can no longer work or provide care for himself. He was diagnosed with chronic heart failure 8 years ago. Current treatment includes both pharmacological and non-pharmacological management of his CHF. Medications include Lasix, isosorbide dinitrate, and lisinopril, and he is also being managed by dietary control. His other health history includes hypertension, chronic kidney disease stage 3, anxiety disorder, and dementia with behavioral disturbance. As this patient has both anxiety disorder and dementia with behavioral disturbance, he becomes easily agitated and aggressive. He hits, kicks, and yells at the staff and his family members, and he refuses medications when he's in this state. It's only when he's calm that he's willing to take any medications or receive appropriate care. Therefore, the nursing diagnosis for this patient is non-compliance due to cognitive impairment, and the interventions include identifying pharmacological and non-pharmacological interventions to decrease the patient's agitation and aggression, and also to help decrease occurrence of episodes. The patient has very limited capacity for self-care due to his diagnosis of dementia. Prior to his hospitalization, he was more independent and had lived in an assisted living facility where his care included management of medication and other basic services. However, the patient's advancing dementia required more care than an assisted living facility could provide, and his daughter decided to take him home with her and hired a caregiver to help him. Illness and hospitalization have further exacerbated his dementia, resulting in behavioral disturbances and inability to provide the majority of his self-care. His ability to perform ADLs is very limited, and it only consists of the capacity to feed himself. While he is capable of bed mobility, he does not have the cognitive ability to know to reposition frequently enough to prevent skin breakdown. He can't manage his own toileting needs, personal hygiene, bathe, or dress himself, and he also cannot safely complete transfers on his own, requiring 2 persons to assist. He does not have the cognitive ability to properly use a cane, walker, or wheelchair on his own. He has no capacity to perform any IADLs. He can't cook, complete housework, manage medications, pay bills, manage transportation, or shop. There are several patient issues for discharge planning. The patient still remains very weak and requires maximum assist with many ADLs. Therefore, he needs physical and occupational therapy to improve his strength. He is also a very high risk for falls due to his poor safety awareness and inability to ask for assistance, which also places him at a high risk for injuries from falls. His worsening dementia results in paranoid thoughts often, and he becomes aggressive and somewhat violent. His family is concerned over his safety and management of his condition if he is discharged home. It was ultimately decided that discharging the patient to a skilled nursing facility was appropriate, as a SNF can provide 24-hour nursing care. This will include interventions to promote safety and prevent falls and injuries. The nursing staff can also manage the patient's medications and attempt to improve compliance. The SNF can also provide physical and occupational therapy several times a week to improve the patient's strength. And if the patient is able to significantly improve, there is a possibility of a goal of discharging home with a caregiver. The patient has both healthcare microsystem and macrosystem level needs. The patient level or the microsystem includes his family to provide both emotional and spiritual support. Nursing care is required for management of medications, assessment of health status, and assistance with ADLs. Physical and occupational therapy is important to improve strength, ability to complete transfers, and capacity to use a wheelchair and a walker. And case management and social services is necessary to provide support to the patient and family and to assist with developing a plan of care and plan for discharge. The patient system level needs would include resource allocation and supportive services. These are both important for discharge planning and collaborating with the healthcare team and family to ensure appropriate discharge. The system level is also at work when the hospital communicates and collaborates with a SNF for transfer of care. And finally, arranging transportation for patient safety would be considered a system level need. Interventions for the patient level would include monitoring patient compliance with the medication regimen and compliance with the non-pharmacological management of the condition. We want to make sure that he is taking his medications and sticking to his diet. We need to collaborate with the healthcare team and the family to identify any interventions that would help to improve his compliance. Another intervention would be to monitor the patient's progress in physical and occupational therapy. We want to identify his actual level of participation, how much he does participate in therapy, and we want to identify realistic therapy goals that will allow this patient to attain the highest level of function. Interventions for the system level would be ensuring appropriate placement for discharge, and this would be done by collaborating with a SNF so that the transfer of care is successful. We also want to monitor the patient's medical stability and screen for discharge to ensure that the resident is safe for discharge and to reduce the likelihood of rehospitalization and negative patient outcomes. We also want to follow up with the insurance company to provide them with up-to-date medical and discharge information, and to identify what services insurance will cover and how many days the patient will be covered to stay in a SNF. Utilization review. UR modalities use established criteria to evaluate medical services for necessity, level of care appropriateness, quality, and the timeliness of discharge. Hospital admission was indicated for this patient as he had become increasingly weak, short of breath, and was noted to have significant edema related to an exacerbation of CHF. His symptoms could not be managed on an outpatient basis. Nursing care was necessary to manage medications and non-pharmacological interventions, assess for improvement or worsening signs and symptoms of CHF, and to assist the patient with his ADLs. Therapy, both physical therapy and occupational therapy, are important to improve the patient's strength and help him obtain the highest level of functioning. The length of stay in the hospital for this patient was 5 days, and the duration was indicated to improve and appropriately manage his symptoms, to help the patient regain strength and return to a previous baseline, and to decide on an appropriate discharge plan. There were several quality and safety issues for this patient. Safety was a major concern. This patient is a very high risk for falls and injury due to his weakness and his dementia. His dementia prevents him from asking for help when he needs to get up to use the bathroom or do anything else. We also wanted to ensure proper management of the patient condition. Quality comes into effect when we're assessing the effectiveness of the plan of care to get him better and to get him on the road for discharge, and also assessing the effectiveness of his medication regimen, whether or not it is improving his symptoms. We also want to ensure appropriate discharge, that he is discharged safely to a location that will prevent rehospitalization for this patient. Case management effectiveness at the patient level is determined by improvement in the patient's condition, which we would see by improvement from the symptoms he was experiencing from his CHF exacerbation. Also, if he is more compliant with his medication regimen and non-pharmacological interventions. And it is also determined by an increase in strength and ability to complete transfers with less assistance. Case management effectiveness at the system level would be determined by if the patient was not re-hospitalized due to him not being well enough to be discharged from the hospital in the first place, and that he was discharged to an appropriate setting. It is also determined by continued management of his health condition by staff in the SNF setting. So management through nursing care, regular physician assessment, and through physical and occupational therapy. Also, it will be determined to be effective if he is able to undergo discharge planning at the SNF to his home. Thank you, everyone, for listening.